Good day, everyone. You're welcome to the fifth recording on HLTINF006, which is Apply Basic Principle and Practice of Infection Prevention and Control. And of course, this is the last video for this particular unit. We're going to be starting from identify, respond, and communicate risk or breach in infection control. Infection control, as we have been discussing in the previous video. Please, if you're just joining us, you have like 4 more videos to catch up with, and after that you can join us on this. So infection control refers to the policies and process in place from each and every organization, and this is done in order to reduce the risk of transmitting a suspected or verified infection either from one person to the other. So this measure varies based on the hazard and the risk identified in your home workplace. We working in the healthcare sector, we understand the vulnerability of people that we are working with. So infection control is a very major thing due to the reason around the immune system of the people in our care. So we have to always put this as a very high risk, and instantly we need to provide a control measures that can really help to reduce these infections. There are times when numerous factors have determined the impact on or violate this control. So to identify potential and actual risk in infection control, we are expected to ask ourselves some questions which will help us to have what they call identifying the root cause. One of them is, how are the people informed about the infection control policies and procedure that your organization has put in place? And how are the infection control policies and procedures enforced? It is good to have policies and procedure in place, but what is the measure by which this information is actually disseminated for everyone to actually be on board? Once we have a very good communication system in place and everyone is on board, we can rest assured that we can get the right outcome. And if anyone actually peradventure breach these policies and procedure in place, of course we'll be able to identify why and how to even understand the nature of the breaches. So a breach in infection control is a failure to follow the protocol for infection preventing and reducing the pathogen transmission. So you must have complete information when identifying the breach. What is the nature of this particular breach? The type of procedure that needs to be followed. What is the biological substance involved in that kind of breach? All this will give you a better understanding of how to control this situation. So responding to risk of potential breach infection control, the following step will assist us in carrying out these tasks. 1. Determine the identified risk, the likelihood and the occurrence. Just going back to our risk matrix, the occurrence, the severity, using the risk metric analysis. Then we select the appropriate measures that will help us to minimize the identified risk. Once this is done, we follow what we call the hierarchy of control. It is a good idea to explore scenario of dealing with actual and potential infection control in form of workplace discussion. So during the discussion, you bring out the hierarchy of control, and everyone that is working in that area, they come up with their own understanding and what are the likelihood of having a resolute solution in order to support the system. So communicate is also essential in determining the best risk reduction techniques. When discussing these issues with your coworker, follow the company policies and procedures. The goal is to select the optimal control measures that can, of course, give us the best solution. The following are example of appropriate person to notify about infection prevention and control. 1, the infection control professionals, the risks managers, the local and state health department, depending on the gravity of that particular infection, the affected healthcare providers, relevant license and regulatory bodies, to mention but few. So manage risk according to relevant guidelines. Risk assessment method must be adhered to in all industrial recommendation. This recommendation covers the following. 1, the current legislation required a hazard or risk to be controlled in a specific way. 2, a code of practice that details way of controlling hazard or risk that applies to your situation or your industry. 3, the well-known and effective control measure in your industry that are suitable to your workplace condition as well. Ensure that the risk assessment method below are carried out in accordance to organization standard or industrial standard. 1, identification of severity of harm caused by this particular infection or hazard. 2, evaluation of effectiveness of existing control measure in addressing this particular risk. 3, identification of likelihood of harm occurring incident related to this particular identified hazard. Once we are able to understand this and put appropriate measures in place, then the next thing is to take immediate action according to the industry and the organization guideline. As I said earlier, once our risk matrix is done, we use the hierarchy of control. Then the most important thing is to think about how to eliminate the risk. If we cannot eliminate it, we should be able to reduce the risk or even substitute it to a PRS minimum. Reducing through administrative control can also be used, and the last means of hierarchy of control is the use of PPE. So considering the following recommendation to assist you in deciding which control measure is best suited to handle or to handle the identified risk, look for information about the suitable control. Refers to the findings if in your risk assessment. Do the cost of control measure in order to understand the gravity of these particular steps you are about to take. In most cases, communicating breach and infection control necessitate informing supervisors, managers, and relevant authorities. So follow by filling the or writing the report explaining the risk-related concern that you've already identified or that you've seen. So while you are doing this particular report, make sure in your report what are the exact risks that you've identified. In that report, we should be able to understand what is it that you think is the issue, and when did you discover the existence of this risk. In which area or location did you discover this risk? Who are the staff or colleagues who contribute to this risk, or who contribute to you identifying this risk? And why do you think this risk must be addressed? All these are part of the things that we As allied as healthcare provider, we need to think about when we are working in our stations, because it can be the ways by which we can usually or actually prevent any catastrophe that are likely to come up during infection control. Managing spills, exposure of blood and fluid. Yes, the general process for spill management would look like this. We gather the skill pits, wash your hand, put on gloves and apron, contain the spill using absorbent agent or paper towel, scoop up the spill and dispose it in a clinical waste bag, clean the area, remove the glove and dispose the apron, dispose of the used PPE in a clinical waste bag, keep used material in their own containers, wash your hand, report the incident and to your supervisor. This is just a general procedure that needs to be followed if we find ourselves in exposure to body fluid or spill. Exposure happens if there is direct skin contact with blood or bodily fluid that provide a risk of blood-borne virus transmission. So exposure can occur when blood or bodily fluid come into contact with an open cut, abrasion, or that means in our skin. So in any way, whenever we are working in our industry, we should always have it at the back of our mind to protect ourselves using appropriate PPE. And the same happens when there is direct contact with mucus or membrane. So even when you are helping a client with their ADLs, please always think of, because these are the time that we can easily contact due to bodily fluid or even blood. So while we are doing this, always, because of the immediate care, or always do your risk assessment and use the appropriate PPE. Follow up any risk that is identified and record them in line with the organization policies and procedure. While we are talking about recording in line with the organization policies and procedure, so we can think about document and report incidents and response. So document information source. You must ensure that they include the following: what happened, when it happens, where it happens, and how it happens. Do the following when reporting incidents: provide an overview of the incident, identify the people involved in the incident, describe the condition of who was involved in the incident, and describe the situation of any equipment that is used. Here are an example of process of reporting the incident. Sometimes we can report incident verbally to the designated person. We can provide details about the incident. We can seek advice on the next step to take when we report the incident, and respond to incident following the designated person's advice. Once all this is done, we need to document the incident and response using the incident report form. Submit the completed incident report form following the organization policies and procedure, and we need to report this to the WHS regulatory, depending on how the organization policies and procedure. Once all our documentation is done, we need to store our record, materials, and equipment in designated area. Record must be stored in container free or spilled dust, aerosols. That is, we need to make sure that the record that we are keeping are always safe, and they are safe from any form of contamination or being exposed to anything that can damage it. Drawer, shelf example must also be used correctly, and we need to label them appropriately. Materials and equipment that have not yet been used or sterilized must be stored in a clean room to avoid any infections. Do the following when storing contaminated instruments and equipment in a contaminated zone. If we use or we already use them an equipment and we understand they are contaminated, we should set a clear boundaries for this contaminated zone. Consider all items in a contaminated zone as contaminated, and control the movement of people and items that are even exposed to this particular area. Decontaminate the item leaving the contaminated zone, and discard the PPE into appropriate waste container after you left that contaminated zone. So whenever you are moving out of the contaminated zone, you can be rest assured that you are clean, and any equipment that is not clean can never come out of that area. This will be the end of our unit HLTINF 006, which is Apply Basic Principle of Infection Control and Prevention. Thank you all for your time, and thanks for joining. I'll see you in our next class. Bye for now.